You're listening to Health Professional Radio with Wayne Buckler. My guest this morning is a little bit unusual for our radio stations. She's not a producer of orthopaedic instruments or CAT scan devices. Jenny Barton of WinC Wrap in Cotton provides cotton. Welcome to Health Professional Radio, Jenny.
Oh, hello. How are you?
I'm very good, thank you. It's lovely to have you with us. Now, tell us, first of all, WinC Wrap in Cotton. What is it that you provide to the health industry?
We provide fitted examination bed sheets to doctors' surgeries, along with modesty sheets and pillow slips. We also provide them to specialists, to massage clinics, to physiotherapists, and anyone else who has an examination-style bed that might need linen.
Notoriously difficult to buy linen for some of those.
Absolutely. A few years ago, the trend went away from fabric linen and it went to disposable linen. And a lot of people have found that disposable linen is ill-fitting. It's actually, whilst it's cheaper in the first instance to buy disposable linen, it becomes quite expensive over a long period of time. And the other problem with it is you actually have to get rid of it. So it all goes to landfill.
Now, Jenny, where are you located first, and what's your geographic footprint? How big an area do you service?
Well, we're located, the head part of our business is in Brisbane. I actually live in Townsville, and my business partner lives in Brisbane, and we do like lots of businesses, communicate through the internet, email, phone calls, whatever. But we service the whole of Australia. So we've provided linen for as far away as Western Australia. Outback Australia loves us because they find it very difficult to actually get supply of any of their supplies. So we actually provide linen all over Australia.
Now, Jenny, you were telling me before about how you got into this business. Just walk my listeners through how you came up to supplying clinic linen.
Well, our business actually started as a gift wrap business with recyclable gift wrap, which would be cotton. So we encouraged people to wrap their gifts in cotton so they could recycle that and use it again and again with a new gift. They could pass it forward, so as to speak. But with the global financial crisis, that became a bit of a problem, and with people wanting to cut back on their costs, of course. So my daughter actually, who works for an orthopaedic surgeon, came to me and said, could I make linen for their surgery because they simply could not get it anywhere? And it's grown from there.
It's extraordinary that there's a gap like that in the market that you can just kind of fall into, I guess. Now, Jenny, what would you like clinicians to know about your product? What is it that makes it of interest to them?
Well, our linen's all made locally. It's all Australian made. We source all of our raw product in Australia. So we try to be good corporate citizens and keep the Australian economy ticking over. Our linen's all made from hospital-grade sheeting. It's made to the highest of standards with double stitching on all the stress points. And we put tunnel elastic in the bottom of the sheet, and that can be replaced when it wears out, if it wears out, because I know that a lot of doctor surgeries use really high temperatures when they actually launder their linen. So we actually pride ourselves on the quality of our linen, and we've had an enormous amount of good feedback about how well our sheets are durable. Like, they last a long time, and they come up looking like brand new. I know the first ones we supplied are now 4 years old, and they look as good as the day we supplied them. So, so it's good quality that we're looking for.
You're listening to Health Professional Radio with Wayne Buckler. My guest this morning is Jenny Barton of WinC Wrap in Cotton, suppliers of examination bed linen, I guess, clinical linen, and a lady with a passion for what she does, and also a background in laboratory work. So I guess, given that you've worked in pathology, Jenny, understanding infection control and manufacturing products that are easy for hospitals to and clinics to take care of is something that just comes naturally to you.
Well, I hope so. We know that a lot of places have tried the disposable linen, and places that use a lot of gels and those sorts of things in their procedures, the disposable linen probably is still the easiest way for them to control, I suppose, the mess. But for other surgeries, a lot of them have going to just like places, commercial places, and just buying a flat sheet and they drape it over their bed. Now, again, that is fraught with a whole lot of problems in that they can slip off the beds and whatever. The way that we actually make our sheets is we put a pocket at the top, we put elastic at the bottom, and then the sheet fits onto the bed really, really tightly. And so as the patient sits on the bed and skews their bottom around, the sheets they put. And so we know that in the workplace health and safety situation, the sheets are actually perfect. They're not going to actually move or slip or slide off the bed. They look good, and we can also colour code them so we can make them to people's corporate colours. We can make them in standard, what I call medical colours, like the pale greens, pale blues, and white. A lot of people like to colour code their linen now so that they make their modesty sheets a different colour to their pillow slip, a different colour to their actual fitted sheets, so that when people go to the cupboard in a hurry and pull out their linen, they're not pulling out the wrong thing, which means that they actually have more washing to do.
Jenny, it's interesting that there's so many details about such a simple thing that just never occurred to me. It never occurred to me for a moment that colour coding would make it quicker and easier for people to do such a simple thing. Tell me something.
Yeah, absolutely.
In every industry there's a misconception or two. What's the misconception about your products and services that drives you nuts and keeps you awake at night?
I think it's actual cost. People see the initial cost of it, and I know that within the medical profession now, I know there's lots of actual practice managers that want the linen, and then the doctor's saying, oh, we can't see the value in it. Then we have other practices where the doctors see the value in it, and the practice owners saying, oh, no, we can't see the value of it. We'd rather have a vinyl bed where we just wipe it over with disinfectant, pop down a piece of paper towel, and it's all done and dusted. But we've actually had those people ring us and say the beds are now too cold for their patients, so we want to put linen back onto them. And so there is a cost, there is an initial cost, but our sheets last for ages. And so if you spread that cost over a long period of time, it becomes very cost effective. And the other thing, there's no cost to the environment.
Jenny, you're talking about there being an environmental benefit as well.
Absolutely.
Is that just in the disposal of disposable linen, you see that?
I know that in Victoria, in the state of Victoria alone, they actually send to waste an enormous amount of medical product every year. It's equivalent to 200,000 households waste in 1 year, which is what the medical waste that is going to landfill. So if we can, in some way and form, make it less landfill, way less waste going to landfill, I think that's an amazing thing, really. It costs $10 million annually to dispose of that waste in Victoria alone.
An extraordinary figure. Jenny, thank you for being with us this morning. If you've just joined us, you've missed my conversation with Jenny Barton of WinC Wrap in Cotton, and we've been talking about linen for clinical practices. However, we have an answer for you. A transcript of this story is on our website, along with a SoundCloud archive, and that's available at www.hpr.fm. If you'd like to find out more about WinC Wrap in Cotton, you can find their website at www.wincwrapincotton.com. This is Wayne Buckler for Health Professional Radio.